All I want to do is go back to Iraq to feel normal again.
I have PTSD from sexual assault trauma, and I'm worried that because of it, I won't ever be able to have a normal relationship.
I have PTSD and have nightmares every night, so I avoid sleeping as much as possible.
Today I was diagnosed with PTSD. Now I'm feeling more anxious and depressed about it. I'm not looking forward to the stigma that comes along with it.
Hello, I'm here with a psychologist that would like to explain a special topic with all of you. Would you like to introduce yourself?
Hello, I'm Richie Shima. Today I'll be explaining post-traumatic stress disorder.
Okay, I'd like to start off by asking, how can someone be diagnosed with PTSD?
Well, PTSD is diagnosed after a person experiences symptoms for at least 1 month following a traumatic event. However, symptoms may not appear until several months or even years later.
How can you define PTSD?
Well, post-traumatic stress disorder, PTSD, is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. If the symptoms get worse or last for months or even years and interfere with your functioning, you may have PTSD.
Going back to the symptoms, like what symptoms can you get from having PTSD?
Well, some symptoms include re-experiencing the trauma through intrusive, distressing recollections of the event, flashbacks, and nightmares. Emotional numbness and avoidance of places, people, and activities that are reminders of the trauma, which is another. And also increased arousal, such as difficulty sleeping and concentrating, feeling jumping and being easily irritated and angered.
For the many patients you have treated, what is PTSD really like and how can it be triggered?
Well, for many people, PTSD is different. For many war veterans, it could be something as simple as a movie or sudden loud noise that can trigger these symptoms. For others, it could be the same loud noise, but it could also be smells or even feelings that bring you back to the experience.
For many people who have PTSD, what can you do to get it treated?
Well, the primary treatment is psychotherapy. There are several types of psychotherapy. Some types of psychotherapy used in PTSD treatment include cognitive therapy. This type of talk therapy helps you recognize the ways of thinking, cognitive patterns that are keeping you stuck. Exposure therapy, the behavioral therapy that helps you safely face what you find frightening so that you can learn to cope with it effectively. And eye movement desensitization and reprocessing, which is also known as EMDR. And EMDR combines exposure therapy with a series of guided eye movements that help you process traumatic memories and change how you react to traumatic memories. You can also get various medications that can help you, such as antidepressants, anti-anxiety medications, paroxetine, and paroxetine may reduce or suppress nightmares in many people with PTSD.
That's interesting. What is PTSD's category under the DSM-V?
Well, PTSD is included in a new category in DSM-5, traumatic and stressor-related disorders. All of the conditions included in this classification require exposure to a traumatic or stressful event as a diagnostic criterion.
How does PTSD affect adolescents?
Well, PTSD in adolescents may begin to more closely resemble PTSD in adults. However, there are a few features that have been shown to differ. Children may engage in traumatic play following a traumatic event. Adolescents are more likely to engage in traumatic reenactment, in which they incorporate aspects of the trauma into their daily lives.
What are some interesting statistics, if you could say any?
Well, most common forms of trauma resulting in PTSD included unexpected death by a loved one, sexual assault, and seeing someone badly injured or killed. Traumatic exposure to at least one event sufficient to cause PTSD was reported by 76.1% of respondents.
That's it for now. Thank you for your time and have a terrific day.
Thank you too, Max.
Hard, and I wish I could just forget my past. But my PTSD makes it impossible.
My ex left me because I have PTSD and wouldn't open up about my deployment.
My PTSD makes me feel alone and unwanted, which makes me angry at people.
PTSD has made me a prisoner in my own mind.
I thought my PTSD was getting better, but then the flashbacks started up again. I'm exhausted.